Large dog breeds, while beloved for their imposing stature, loyalty, and protective nature, also come with unique health challenges that owners must be prepared for. These dogs often require more specialized care, attention, and veterinary monitoring due to the inherent risks associated with their size and weight. Although large dogs can be healthy and live fulfilling lives, they are generally more susceptible to certain health issues compared to smaller breeds. Understanding these challenges is crucial for prospective owners of large dogs, as it helps prepare them for the responsibilities that come with caring for a large breed, and ensures that these dogs receive the proper care to maintain their health and well-being. But first, a brief intermission to remind you to sign up today to become a premium member of the Top 5 channel for exclusive content and bonus perks. And now, back to our programming. One of the most common health issues affecting large dog breeds is joint and skeletal problems, particularly hip dysplasia and elbow dysplasia. These conditions are more prevalent in larger breeds due to the increased strain that their size places on their joints. Hip dysplasia, a malformation of the hip joint that causes pain, stiffness, and eventually arthritis, is particularly common in breeds such as Thai, German Shepherds, Labrador Retrievers, Rottweilers, and Bai St. Bernards. The condition can cause severe discomfort and limit the dog's mobility, often leading to the need for medication, weight management, or even surgical intervention to alleviate pain and improve quality of life. Similarly, elbow dysplasia affects large dogs by causing malformation in the elbow joint, leading to pain and reduced movement. The combination of genetics, weight, and the stress that large dogs place on their joints over time makes them highly susceptible to these conditions. Preventive measures, such as controlled exercise, maintaining a healthy weight, and providing joint supplements, can help mitigate the effects, but it remains an ongoing concern for large breed owners. Another significant health challenge that large dog breeds face is bloat, or gastric dilatation volvulus, GDV. A life-threatening condition commonly seen in deep-chested breeds like Great Danes, Doberman Pinschers, St. Bernards, and Irish Wolfhounds. Bloat occurs when a dog's stomach fills with gas and becomes distended, causing it to twist. This twist can cut off blood supply to the stomach and other organs, leading to shock and potentially death if not treated immediately. The exact cause of bloat is not fully understood, but it is often linked to feeding habits, such as eating large meals quickly, genetics, and physical activity after meals. Symptoms of bloat include a swollen abdomen, excessive drooling, restlessness, and unproductive attempts to vomit. It is considered an emergency condition, and surgery is typically required to untwist the stomach and prevent further complications. Preventive measures, such as feeding smaller, more frequent meals and avoiding vigorous exercise after eating, can reduce the risk of bloat, but it remains a serious concern for owners of large dog breeds. Cardiac problems also pose significant health risks for large dog breeds. Dogs of larger sizes are more prone to heart disease, particularly conditions like dilated cardiomyopathy, DCM, which affects the heart's ability to pump blood effectively. DCM is most commonly seen in Doberman Pinschers, Boxers, Great Danes, and White Irish Wolfhounds. As the heart weakens, blood flow to vital organs becomes compromised, leading to symptoms such as lethargy, coughing, difficulty breathing, and, in severe cases, sudden heart failure. Because large breeds have a naturally higher heart rate and larger circulatory systems, they are more susceptible to the pressures that cause heart disease. Early detection is key, and regular veterinary checkups are crucial to monitor for signs of heart problems. In some cases, medication can manage the symptoms of heart disease, but it remains a chronic condition that can significantly impact the dog's lifespan and quality of life. Preventative care, such as regular vet visits, maintaining a healthy weight, and monitoring for early symptoms, is vital to managing cardiac health in large dogs. Obesity is another serious health issue that disproportionately affects large dog breeds. Because large dogs have a higher baseline weight, they are naturally more prone to gaining excess weight, which can exacerbate other health problems, particularly those related to their joints and heart. Obesity in large dogs puts additional strain on their already vulnerable joints, making conditions like arthritis, hip dysplasia, and elbow dysplasia worse. Moreover, extra weight increases the risk of heart disease, diabetes, and respiratory issues. Dogs that are overweight or obese often have lower energy levels and may struggle with basic activities like climbing stairs or walking long distances. For breeds with high energy, obesity can also limit their ability to exercise and participate in outdoor activities, leading to behavioral problems such as boredom or anxiety. Maintaining a healthy diet, providing regular exercise, and monitoring weight are essential for managing obesity in large dog breeds. Owners should work with their veterinarians to develop a weight management plan that suits their dog's age, breed, and activity level. The lifespan of large dogs is generally shorter than that of smaller breeds, and after aging comes with a variety of health challenges. As large dogs age, they often experience musculoskeletal degeneration, including arthritis and muscle loss. Older dogs may also become more susceptible to cognitive dysfunction syndrome, similar to dementia in humans, which can result in confusion, disorientation, and a decrease in mental sharpness. The combination of age-related physical decline and the inherent health issues that large dogs face can result in a reduced quality of life, making it important for owners to adapt their care strategies as their dogs age. This may include providing joint supplements, modifying exercise routines to prevent overexertion, and ensuring the dog has a comfortable living environment that accommodates their physical limitations. Regular veterinary checkups, along with early intervention for age-related issues, can help mitigate the effects of aging and improve the dog's quality of life in their senior years. Large dog breeds are also more prone to PAMS breathing difficulties due to their size and the physical stress placed on their respiratory systems. This issue is particularly noticeable in breeds with chance brachycephalic, flat faces, such as the Bulldog, Boxer, and St. Bernard. Although these breeds are often not as large as others in terms of height, their short snouts lead to obstructed airways, which can cause difficulties in breathing. This condition is referred to as brachycephalic obstructive airway syndrome, BOAS, and it can result in snoring, excessive panting, heat intolerance, and, in severe cases, difficulty breathing, especially during physical exertion or in hot weather. Larger dog breeds with less pronounced respiratory issues may still experience difficulties, particularly in environments with high humidity or in hot climates. Therefore, managing these breeds' activities and ensuring that they do not overexert themselves is essential to maintaining their health. In addition to these physical health concerns, emotional and behavioral health is a significant aspect of managing a large dog's overall well-being. Large dogs often require ample mental stimulation to avoid behavioral issues, such as destructive chewing, excessive barking, or hyperactivity. Their high energy needs, combined with the risk of joint issues and reduced mobility as they age, may lead to behavioral changes if not properly addressed. Dogs of large breeds are also highly social animals and can develop separation anxiety if left alone for long periods, which may manifest in destructive behavior or excessive barking. Providing mental stimulation through training, toys, puzzle games, and regular socialization is crucial in preventing these issues. The overall veterinary care for large dog breeds can also be more expensive compared to smaller dogs. The sheer size of these dogs means that treatments, medications, surgeries, and even routine checkups can be more costly. For example, the cost of surgery for joint problems, such as hip replacements or treatments for bloat, can be significantly higher for large dogs than for smaller breeds. Veterinary care for large dogs also requires specialized knowledge, as they may have different nutritional, exercise, and care requirements compared to smaller breeds. Pet insurance can help manage the cost of care, but it's important for owners to be prepared for the financial responsibility associated with owning a large breed dog. In conclusion, large dog breeds present unique health challenges that require careful attention and proactive management. From joint and skeletal issues such as hip dysplasia and bloat to heart disease, obesity, and respiratory problems, large dogs are more vulnerable to a variety of health concerns. These challenges can affect their quality of life, lifespan, and ability to participate in activities. However, with proper care, early detection of health issues, and regular veterinary checkups, owners can help their large dogs lead healthier, more comfortable lives. The bond between large dogs and their owners is deeply rewarding, and being aware of the health challenges that come with these breeds allows owners to make informed decisions about their care, ensuring that their dogs live long, fulfilling lives despite the inherent risks associated with their size. Thanks for watching.